ahead. And as I'm going through the presentation, if you all want to introduce yourselves through the chat, if you want to say your name, where you're based, and what brings you to this roundtable. So if you're a patient, person with lived experience, if you are a clinician, a policy person, whatever that is, definitely feel free to include that in the chat because we like to see where everybody's from and what stakeholder group that you all represent. But a little bit about Generation Patient. So we are an organization representing young adults with chronic and rare conditions. So we are not disease specific. Our work spans everything from peer support to work in evidence generation as well as policy. And peer support is really the bedrock of Generation Patient as far as the way that we try to build community and also use that to implement more or greater systems change. So before we get started, we really want to thank the Lucile Packard Foundation for Children's Health for supporting this roundtable series. We also convened a medical advisory board and a patient advisory board late last year that helped come up with these topics that we are going to be addressing at our roundtable every single month. And then Catherine Melton, who's here, who's helping write the proceedings documents that come out of these roundtable sessions. Oh, and I totally forgot to introduce myself. So I'm Sneha. I am the executive director at Generation Patient. And so we'll be helping facilitate this roundtable. So the goal of this roundtable is really, we have a couple of goals, but just distilled down, we hope to publish a proceedings document in a peer-reviewed journal that further identifies the systemic challenges as well as opportunities for young adults with chronic conditions. And then we hope to continue multi-stakeholder collaboration to identify outcomes and improve outcomes for our community. And we did replicate this actually specifically for young adults with inflammatory bowel diseases 2 years ago. And so we had a series of peer-reviewed publications that came out of roundtable discussions like the one today. And of course, this is not disease specific. So very briefly, I mentioned that at Generation Patient, peer support is really the bedrock of our work. And I think it's really important to highlight why we exist and why we really believe in the power of peer support for our community. I think at Generation Patient, we really believe in peer support as an intervention rather than just a nice to have service because we've seen the power of it for, I would say, for ourselves, but also for our community members. All of our staff have lived experience as well, which I think makes it really, really powerful for us to be the ones leading what this support looks like. So here are just some statistics. There's about 25 million young adults between the ages of 18 to 34 with at least one chronic condition, and our community is 363% more likely to attempt suicide, and there's very few solutions that have existed to create community and reduce isolation that are really widespread and accessible to young adult patients across the US and internationally. At Generation Patient, we've done over 600 peer support meetings, which is wild to say, since March of 2020. We have four different types of peer support meetings that we do. Two specific to young adults with chronic conditions as a whole, two specific to young adults with IBD, two specific to students with chronic conditions, and we just launched this year our peer support meetings monthly with our community partners in South Asia as well as East Africa. So we are a bit international as well with our peer support work now, which is really exciting too. And lastly, I will just say that we did a roundtable series. It's a different type of roundtable that we did on peer support. And we had a multi-stakeholder group that we brought together every single month to talk about research possibilities, patient-centered comparative effectiveness research for peer support interventions. And so we have several different resources on our website related to that. So we have a peer support toolkit, a guidance document for researchers, a companion checklist, and a couple of other resources on our website. So, Dr. Maslow and Alexis are going to be presenting both the patient experience as well as the research and clinician experience, respectively. And at the end, so their presentation collectively is going to be about 20 to 30 minutes. And for the rest of the time, we are going to be having a discussion with you all. And so just some agreement. So constructive debate is encouraged. If you don't agree with someone else, that's okay. And that's part of why these roundtables are so powerful because we have different perspectives and viewpoints that come together. We do use Chatham House rules, so we won't attribute anything that you say to yourself unless you'd like us to in the proceedings document. Identify an issue and provide a potential solution. You don't have to provide a potential solution, but it is helpful as we think about next steps for this discussion. There are no off-topic comments. I think sometimes there is fear, hesitation of bringing something up, but just know that whatever you share is valuable and really encouraged, especially for our young adult patient community partners that are here today. Definitely, are excited to hear from you all based on your experience with peer support, but also just your experience navigating any of the mental health systems. And then please use the hand raise function if you have something to contribute. And if you at any point need any help or anything at all, feel free to message me and Rosa, who's our program manager and actually has led a lot of our peer support work, is also willing to help coordinate if you have questions or would like to say something. So please feel free to message Rosa as well. So with that, I'm going to hand it over to Alexis if you would like to share your screen, and then we'll hand it over to Dr. Maslow after that.
Okay, sounds good. Let me share my screen. Okay. Okay. So, hi everyone. My name is Alexis. I use she, her pronouns. Thank you, Sneha, for inviting me to present at this roundtable. So just a little bit of background about me. I was diagnosed with Crohn's disease in 2022, so it's been a little over 3 years now. I started attending peer support meetings with CCYAN, which is an IBD specific group under Generation Patient, but eventually I started familiarizing myself with Generation Patient as a whole. But yeah, I started attending their peer support meetings about 2 months after my diagnosis. And like I said, I've been attending both CCYN and just general Generation Patient peer support meetings since. And I'm currently a 2025 CCYAN fellow. So I just wanted to share a bit about my experience on why I decided to start participating in peer support and essentially what led me to it. So when I was first diagnosed with Crohn's, I was physically isolated from others. And so as a result of that physical isolation, I also felt just isolation in general in terms of like what I was experiencing. I was 18 years old and my first year of undergrad was cut short because of my Crohn's. And I ended up having to withdraw from my university for a quarter because I wasn't well enough to return to campus at the time. And yeah, so I felt like a bit emotionally isolated from friends and family who they couldn't quite relate. They didn't quite know what to say. Um, and yeah, and even though people want to be there and they want to offer support and they want to offer a listening ear, sometimes it doesn't quite hit the same, when you know that they can't relate to what you're experiencing. So before I ended up having to withdraw from university, I was using their counseling and psychological services at the time. And so my therapist, she knew I was struggling to cope. She knew I was struggling, with my new diagnosis. And so she was researching some resources to help me out. And she was actually the one who ended up finding the Crohn's and Colitis in Adults Network. And she suggested that I check it out. And so When I saw that they had peer support meetings, I was like, okay, I'll attend, I'll see how it is. And, it was also helpful that they were accessible. They was through Zoom, so I didn't have to like rely on anybody to like drive me anywhere to attend peer support meetings. So now I just want to share a bit about my peer support experience. So when I started going to the meetings, I was surprised to find that I wasn't the only young adult like going through these life-changing events. And it was honestly like the first space that I had been in where I felt like people understood what I was feeling, even if we didn't have the same chronic illness. For example, like almost everyone at the meetings could relate to a certain extent of missing school or having to take medical leaves from school, having to find the time and the energy to schedule doctor's appointments, having to navigate side effects from their medication. And, they're all doing this as students, as young adults, starting their careers just like I was. So that was very surprising for me because, it was very easy for me at the time to feel like nobody goes through this. Like, who is 18 years old and having to go through this? And then seeing that everyone else is also going through it, it was like very shocking for me. Um, the peer support meetings were also, I would say, the first space where I felt like I was being validated, but I wasn't being like pitied, So I could be expressing a challenge that I was going through, and people wouldn't be like, oh my gosh, like that's so horrible, but you're so young. Like, how do you do it? I could just share a certain experience, and people in the group would just kind of like nod their heads and they just listen and they'd be like, same, or, I can relate. And that was just very new for me. Um, and so I've been going to these meetings fairly consistently, I'd say, for about 3 years now. And even 3 years later, they're still very like cathartic. But at the same time, some meetings can also be more lighthearted and fun. It doesn't always have to be, super heavy. We can just chat about like random stuff and crack jokes and talk about, other things going on in our lives. And yeah, because it's essentially just a place where I've managed to find like community and build friendships. And yeah, it's just a space where I get to interact with other people who they just get it. They understand. And I would say that peer support meetings, just overall, I consider them to be part of like my well-being toolkit. So I wanted to kind of compare a little bit like my experiences with peer support, but also my experiences with like a more traditional form of like mental health treatment. So one that I've experienced is cognitive behavioral therapy. Um, so peer support specifically, I would say I think of it as non-clinical in the sense that you don't have to like schedule an appointment to, see somebody. Ideally you don't have to worry about like, oh, does my insurance cover this and stuff like that. Um, and peer support to me is about, like I said, building community and friendships with other people. And it's basically a space where people can kind of share helpful tips and tricks with each other, obviously not to be substituted for, professional medical advice, but, like for example, I think at a recent meeting, people were saying like, oh, with the summer and the heat, it kind of is making me feel more symptoms. And so it's just like tips and tricks of like how to stay cool during the summer, just things like that, that is just helping one another. And it's also a space where people are able to share, their experiences, and you find common ground with people. You realize that everyone has probably gone through something similar, despite, whether or not you have the same disease. Because I think chronic illness in general, there is to be said like a certain experience that I think most people can relate to. And then with cognitive behavioral therapy, I think of it as like a clinical intervention in some way. In my case, I had to schedule an appointment with a therapist. Um, And yeah, and I had to, be like, okay, like, is there going to be a copay and, things like that. Also, um, CBT is generally short term, at least it was in my experience. So it's not something that I probably would have been harping on the same thing maybe 3 years later, because it was, for me at least, my case was more like goal oriented. And part of that was building problem solving skills to cope and to challenge negative beliefs and distortions. And also with cognitive behavioral therapy, as we all know, it's, one-on-one with a therapist, but it can also be done in groups. Um, but yeah, I just wanted to share kind of like a comparison of peer support and also CBT, just because I think that they're different, but I also don't think that they should be a substitute for one another. I think they're both very important, and I think that both should be in patients' toolkits for their overall like well-being. And I also wanted to share about a little bit about the timing of like peer support intervention. So I would say in my case specifically, I started doing peer support very shortly after I was diagnosed, like only about 2 months afterwards. And I think that talking about my experiences early on helped me significantly in accepting my disease and feeling less shame and feeling like I didn't have to hide that part of me. And I would say also that by going to the support meetings, I learned to advocate for myself more quickly than I probably otherwise would have. And I felt significantly more empowered to ask questions at doctor's appointments and seek what I needed from my providers. And I would also say that having that early support definitely helped me feel more confident and feel like I was deserving enough to build a care team of providers that, I felt really good about. Because I think that otherwise, if I would have continued to feel like the only young adult going through what I was going through, which I did feel at a certain point of time, I think I would have had a much more difficult time accepting my disease and coping with it. And yeah, so I think that timing was very critical and very important. And I would just say overall that peer support is helpful at any stage of a patient's disease, but I would definitely encourage people to have patients seek that peer support and build that community early on, because it can make a big difference. At least in my case, I definitely believe that it did. And yeah, it definitely plays a role in allowing patients to feel more empowered, to feel more supported, to feel less ashamed, to feel less alone, and to know that, yeah, ultimately they're not the only ones going through what they're going through. Um, but yeah, I believe that's all I have. So yeah, so I'll go ahead and stop sharing and I'll hand it over to Dr. Maslow.
Yeah, thank you so much. That was really, yeah, it's really I appreciate your giving us a sense of what it's like to go through that and also the timing and thank you so much for sharing your personal experience in that balance with like what is peer support for versus therapy. And just really thank you for co-presenting with me and for sharing that perspective. Um so I'll share my screen and um I can make it work. And I really appreciate the opportunity to be here. I think I first met Sneha at a, something on the Duke campus, like an in-person meeting before the pandemic, maybe. I don't even really remember. It was in person though, and it was in like the Global Health Institute, and it was really interesting. And then it's amazing what you've gone on to do. So you probably can remind me what the actual thing was, but it was really cool to see the young adults coming together. Um, and where Generation Patient has gone has been amazing. Um, so I'll try to be brief, and I have slides I'll go through a little bit quickly. Some of them are just pictures. But I'm a pediatrician and a child psychiatrist. And I met Duke University, and affiliated with both the School of Medicine and the School of Nursing, which has been great. Um, and the I thought I would kind of talk about my own experience with being involved in running programs for peer support, and really reflecting a little bit on the diversity of programs. So peer support is really, really, really as diverse as the people who participate. There are group programs like Generation Patient. There are also programs that are in person versus online. So you sort of have these different dimensions, and there's probably, multiple different ones. But the top one is one that in the article that I shared is mentioned. They call them therapeutic camps, but summer camp. And so that's a picture from a summer camp I went to. And all those kids have diabetes, type 1 diabetes. And the ones who are holding up signs are the ones using a pump. And so just kind of an example of relatively young kids who are at summer camp and getting a lot of peer support. And if they go back year after year and then become a counselor, they really can get a lot out of that, peer involved, relationship. Some of it's short term and some of it's long term because they get to know people over time. They're in-person groups. So this is a picture of Atlas, which is one of the programs I'll talk about briefly, which is one of our teen programs at Duke. But that's a group of college students who are serving as mentors to high school students, but they meet in person and they also do some virtual stuff. And then there is individual support, so one-to-one mentoring, which again can be, either in person or remote. And then iPeer-to-Peer is a really cool program from Canada, from Toronto, that does online support in kind of an individual way. But those are just the different dimensions that I think about, at least as some of the components of the diversity of peer support, but there's a lot more than even that. This is, again, from the article or from the chapter. Here's another way of having all these dimensions, and I don't want to go through it, but you can really think about the complexity of studying peer support is when you say peer support, you actually have to specify what age, what group, where, who, how is it delivered, group or individual, and so to study that, you actually have to get fairly specific. And that's one of the challenges, I think, in research around peer support is, I think the evidence is that peer support is important and really meaningful, but what peer support for which person and how to provide people with an array of choice and is something that we haven't, I think, figured out fully, and certainly is not supported in the health system. So just from the literature, there are a lot of positives: improving mental health outcomes, helping people get more involved in their care. There's thoughts about resilience, social isolation, self-management, improvement in pain management, adherence. So a range of different, some of these are what we call patient-centered outcomes and ones that are actually important to people. And some of them are medical focused outcomes. People don't say I'm adherent to my medical therapy. Like that's not a patient-centered outcome necessarily. And so, how to choose the outcomes that matter. A lot of my focus is the positive youth development model, which is really a strength-based approach. And the idea is, how do you help a young person thrive? And it was, it originally came out of a lot of work with 4-H. But a program, and so again, you can decide as a peer support intervention a program or not, but a program needs to have 3 components for it to be effective at promoting positive youth development. One is opportunities for graduate leadership. So like the idea of how do you become a leader is really important for youth development. Skills-based, so you're actually learning something and sharing information, and that there's some kind of sustained caring adult-youth relationships. A lot of different types of programs, and sounds like Generation Patient in some ways is actually level, like meaning peers are, it's co-support, and there's a lot of programs, again, substance use programs have led the way with this that are like Alcoholics Anonymous. That's a peer group that is not led, there's not a hierarchy there. In young adult development, and depending on the age, there is something about having the potential of near peer, having, someone who's a little bit older who's been through something. So if you are, in high school and you're thinking about going to college or getting a job, having a mentor or someone who's been through that can be really helpful. And it improves outcomes by enhancing the 5 Cs, which is just jargon, but this is sort of the model. And the idea is that you build these assets and youth through a range of things, but peer support being one. You can create connection, help people feel competent or have competencies, be confident, have character, and be connected, having caring. And as a result, you get increased contribution, meaning helping the world, also decreased risk behaviors, depression, and other negative things. But the really key thing is that PYD, the model, is that youth have strength. They have ecological assets, meaning strengths in their community, but also individual strengths. And so we need to enhance this and view youth as meaningful contributors to their own development, as opposed to this a program that does something to them. And so I like the 5 Cs. a positive development for young adult interventions. Certainly, as you get into adult interventions for people who are in their 20s who have already finished, certain milestones, PYD may not be the right framework. So this is probably for the younger AYA population. We actually had a program collaboration called LEAP. We had 5 or 6 programs that had used the same model. I started college at Dartmouth, and that's where was involved in the STAR program, which was the first one. We have a program at Brown called TALC, and then when I came to Duke, we started Atlas. It's really cool to have someone from the Packard Foundation here. We actually had PALC, which is at Stanford, and I think it was originally funded by the foundation. And one of my co-residents at Brown went to Stanford, and they had, I don't know if I think the program has stopped, but for several years, probably 8 or 6, 7, 8 years, they had a program that the foundation that supported that was providing peer support in the model that I'll describe at Stanford, as well as in Indiana, and another program called Next Step is in a wonderful program in Cambridge. But just again, I'm not going to spend a lot of time on this, just in the interest of time, but the programs that this Atlas program, there's leadership. How do you educate people? So the participants will educate residents, or they'll promote transition at Duke. There's skill-based. They learn skills about chronic self-management and focus on transition. And then there's mentorship with a college student who has an illness, really serving as a mentor. And just again, going back to this model, again, I know this is way too fast and sort of a little bit tangential, but the idea of this STAR, TALC, Atlas, those kind of programs is they really help youth have leadership and shape their experience. They're the sustained adult relationships and their skill building. I put parent support in here because peer-to-peer support is also really important, and that can help youth if their parents get support or their caregivers. And then I'll talk briefly about our individual peer coaching, which is called Picasso, that doesn't really have the leadership component, right? It has sustained adult relationship and skill building. These are just images from the TALC program. So this is a newsletter that the teens distribute to all the physicians in the hospital about 10 strategies to keep in mind when you're talking to a teen patient. They did art. So here's a picture, a drawing of a medical team. And just kind of, again, that ability to share through art. And then they did this mural, which is really cool, which has all their different illnesses. So like, I think there's like the purple thing's a magnet. And I think this young woman, that's a magnet that she would use to like activate her VNS. There are a lot of pill bottles. There's a turtle that somehow represents lupus. There are needles that represent diabetes. So it's kind of, again, this group of 15 young adults, high school students, and probably 5 college students, put this together and then shared it in an art exhibit. And the Atlas program, again, this is a picture of them. We have a summer camp print, so kind of merging the summer camp idea, but having it be a little bit more like a conference. So it's fun, but it also has some education, and that comes from the start of the Next Step program as well. So here's just a brief quote. Just about every session, I hear comments from participants that they learned and appreciated advice from other participants and mentors about strategies for handling these unique obstacles we face as patients with chronic condition. Atlas is a space for expression, but also for learning how to better balance life and disease without one getting in the way of the other. And during kind of monthly meetings, both online and in person, this group of youth come together. Next Step is just the coolest program in peer support. If you get the chance to check out their website, it's really incredible. They do conferences. They're kind of created this really amazing model for a range of different conditions. But then they also have like a center, and it's in Cambridge where youth can come. So they have hundreds of youth come each year who are going to hang out at their space or make a music song in their song studio, or are getting, vocational training. So it kind of actually combines like hard skills, like how do you actually learn to develop, like make the next step in context of this really supportive, engaged environment. So they just do a really amazing job. And their idea is you need to engage, you need to educate, and then you empower. And the goal is to get everyone to be empowered. For me, what I'm very excited about is peer support in general, but I really like peer coaching. And so peer coaching is something we've been studying, but the idea is that it's a way to have to leverage the power of peer support and combine it with another intervention, which is health coaching. So helping you actually someone who has a chronic illness, spend time with a peer coach who's helping them think about their life and reflect on what their values and goals are, and doing kind of an intentional way. And so we have an NIH study that has just concluded, but basically we had teens, young adults 16 to 22, I think. And then we had peer coaches who again were near peer, and it was all telephone based, which is, so it was a little analog, and they could also text them. And they'd have this one-to-one mentoring relationship that spanned a year. And the coaches were actually hired. And in the article, they talk about this, the balance of having peer support when it's done individually as a voluntary thing versus it's something it's an intervention that's valued enough that we actually should pay the people who are doing the support. And I think there's a lot of pros and cons to those two different approaches. And then again, the substance use field is the one that's the furthest ahead in peer support and behavioral health. There are peer groups that are, again, fully voluntary and fully, you know, community based. And then there are peers who are part of medical teams and that are a part of care teams. And so you can be employed as a peer support specialist in North Carolina and be actually out there helping people. And so it's kind of interesting as you think about that balance of volunteerism, mutual support, and actually a paid job. But for us, the coaches we hired were part-time employees, and they all had a range of different conditions. They completed 50 hours of training. So a pretty significant amount of training to become health coaches. They went to health coaching themselves. And then they had really high quality supervision where they were meeting with a psychologist or social worker at least bi-weekly, sometimes weekly, and meeting as a group. And then the outcome, this is a year-long study with a control group, and there are like 9 different conditions, chronic, young adult chronic conditions, with 130 actually receiving the coaching intervention. And it was really a lot of engagement. So on average, there were 11 coaching calls, or the median was 11 coaching calls over a year, with most of them happening in the first 6 months by design. There were 50,000 minutes of coaching calls, 12,000 text messages exchanged. Again, 130 participants, and that's a lot. It's just a lot of communication back and forth. And then this is our key finding, that there was improvement in this Partners in Health self-management scale, such that self-management did clinically improve as compared to the control group at 6 months and 1 year. And there is some separation here. If you're interested in effect size, it's a medium effect size, and we think it's clinically significant. But the idea of like what it takes to do this, this is an NIH-funded large study that gets us data about this one specific peer coaching intervention that I think is really meaningful and hopefully will support, more peer coach work. But knowing that this works doesn't necessarily tell you about another kind of peer support program, and that's one of the challenges of peer support work. Just so a brief quotes from the coaching program. My coach understands what I'm going through when no one else does. On the coach's side, they really got a lot out of it. Each time I go through the coaching process, the participant, it feels like I'm also going through it. I become more confident outside of coaching. So again, the coaching intervention helps both the person being coached and that. These are just a list of some of our current programs, both for research, clinical, and other things. And then just giving you a sense of the scale. We've trained over 40 youth to be coaches, and have coached over 300 youth, and are really excited to kind of keep going. We also have a prom that is a part of the program that happens every year to celebrate young adults, and is called Jody's Prom. It is a really great, again, celebration of young adults. Is that peer support? I don't know. It's not really a peer support program, but it does bring young people together. And that's just our multidisciplinary team. So again, I appreciate the chance to be here and the opportunity to have this discussion. And I know Sneha put a lot of thought into this group and being able to have a discussion about peer support.